we would like to know your views on black fungus. Professor Dr. Aravind, please.
Good morning. Thank you, sir, for the kind introduction. I will start from where John Panikkar sir left off. The most intriguing aspect is, as John Panikkar sir did say, we used to see mucormycosis prior to this COVID pandemic also. In 2019, that is in 2020, following the first wave in Kerala, it peaked in October. We had only say maximum 12,000 cases during the peak during the first wave. Our institution saw around 6 cases of post-COVID mucormycosis. Okay, but then usually we used to see around 15 to 20 cases of mucormycosis every year, say up to say 2019, because our catchment area is pretty huge. We cater to people in the belonging to the neighboring districts in Tamil Nadu, and also in the same campus we are having the central government institutes like Regional Cancer Center as well as Trijitra. So actually in 2020, even though we did have 6 cases of COVID-associated mucormycosis, it was below the background rate. But in 2021, now in the state, we have around say 60 confirmed cases of COVID-associated mucormycosis. When compared to the rest of India, like as you mentioned, Maharashtra, Gujarat, Telangana, Andhra Pradesh, Karnataka, this number is actually pretty less. But when we look at the background rate of the number of infections in Kerala, which we used to see till say 2020, this number is actually gradually coming up. Now we need to know whether this mucormycosis is an infection which is confined to India or the Indian subcontinent. It is actually not. But if you look at the published literature from across the world, majority of the cases are from India. But there is a difference between the mucormycosis getting reported from, say, North America or, say, Europe or other developed nations from that in Indian subcontinent. Since there is an increased number of patients who are getting treatment for hematological malignancy, for transplantation, etc., we are creating an immunosuppressed state. And that is the reason why there are more number of cases of mucormycosis in the Western world. Whereas in India, the increasing number of cases of mucormycosis has always been related to our poor glycemic control. That is, India being the capital of diabetes in the world, naturally we also became the capital of mucormycosis in the world. As John Panikkar sir did mention, ours is a hot, humid, tropical climate, means that it is ideal environment for fungus to thrive in your environment, and every day we are inhaling spores of mucormycosis. But then inhaling a spore of mucormycosis does not ensure that we will get the disease. To get any disease, we have to have 3 factors: the epidemiological triad, the agent, the host, as well as the environment. So the agent as well as the environment is there in abundance in India. So anyone can get mucormycosis if they are the susceptible host. Now, who is the susceptible host? This is the most important aspect. A susceptible host has to be an immunocompromised individual, because we are inhaling the spores, and if the spores do get into our body, our monocytes, the phagocytes, and the neutrophils are capable of devouring them and get rid of the infection. But when your immunity goes down, the clearing of the fungus, that may not be optimal, and that is when you get infection. So immunocompromise in India, a majority of the patients who developed COVID-associated mucormycosis had this uncontrolled diabetes mellitus. So in a recent meta-analysis of the 111 cases of COVID-associated mucormycosis in India clearly showed that around 85% had uncontrolled diabetes mellitus, around 76% had used steroids. So these two will contribute the major bulk of why in India COVID-associated mucormycosis is on the rise. But having said that, why the rest 15% of the patients are developing mucormycosis? Young patients are developing mucormycosis. Those who are not being exposed to steroids, those who are not diabetes, they are also developing mucormycosis. And to add on to this, we are having our neighboring countries are also having the same climate. They are having also almost the same burden of diabetes. They are also using steroids, but then they are not having the same burden of COVID-associated mucormycosis. That also has to be looked in. So definitely, COVID-associated mucormycosis is closely linked to uncontrolled diabetes. If your RBS, blood sugar levels, are more than 300, definitely there is a glucose regulator. That's a GLP. This glucose regulator protein, which is getting upregulated in your blood vessel line, which is known as the endothelium. And to the hyphae of the fungus will go and attach. And in uncontrolled diabetes, there is a situation known as a diabetic ketoacidosis. Means that your pH in the blood will become acidic. So when there is an acidic pH, it is an ideal environment for the fungus to grow. And in an acidic pH, there is increased availability of iron also. This fungus require iron for growth. So when there is acidosis, so when there is increased availability of glucose, when there is increased availability of iron, this fungus will definitely thrive. So when this fungus thrives, so it will attach to the epithelium receptors in the nasal mucosa, and that is how it gets into your sinus, this part. And if you are not diagnosing it at that stage, it will extend to the eye, and then it will extend to the brain. And definitely the rhino-orbitocerebral mucormycosis is the most common form which is detected in the diabetic patients. The pulmonary mucormycosis is actually is there in diabetes associated mucormycosis, which is actually relatively rare. The second aspect is usually the unscrupulous use of steroids, because we cannot blame steroids. We have been using steroids for treating so many other diseases without development of mucormycosis. Okay, so steroids have to be used at the stage of hypoxia, when the patient is breathless, when there is desaturation. Steroids are the drugs which are life-saving in COVID-19. But then the practice across India is not uniform, even though the protocols clearly mention that only those patients with moderate disease, moderate severity of COVID-19 should be put on steroids at the right dose. The right dose of steroid at the right time, at the right, or the right patient for the right duration of time is very, very important. Treating all patients with the steroids actually will invite trouble, as what is being observed across India. So when steroids are used, it will drive up the blood sugar levels. Also, steroids will bring down your immunity. So these are the two major contributing factors. Then we need to look at other practices, because the use of steroids is universal. The diabetes is also present in other parts of the world. We need to look at certain practices which are maybe more being done in India. So non-protocolized practices. So what actually prevents the fungal spores from entering your body is your integrity of the nasal mucosa. So your skin and mucosa are the ones which protect against the dangerous bacteria as well as the fungi. So usually in the nature, the fungus is kept in place by the good bacteria which are present in our body, which includes the nose also. So the unscrupulous use of antibiotics. We know COVID is a viral pneumonia. So if you are using, say, azithromycin, so which is being prescribed across India for treating for COVID-19 infection, what will happen is that the bacteria in the nasal mucosa will be lost, and this bacteria is the one which is supposed to suppress the growth of the fungal spores if they come into the nasal mucosa. So by the use of antibiotics like, say, azithromycin, the good bacteria in the nose is actually lost. And the second aspect is that, so even if the bacteria is lost, the integrity of the nasal mucosa will ensure that the fungal spore won't be able to penetrate into our sinus. But what happens here is the practice of the steam inhalation. Okay, steam inhalation is actually a very, very good thing for symptomatic. If there is a nasal block, etc., the steam inhalation is pretty good. But somehow, the message which has been conveyed by many authorities is that if you are doing steam inhalation repeatedly, it can keep away. It can protect you from getting COVID-19. That is totally a false thing. Steam inhalation can never protect someone from getting COVID-19. And repeated steam inhalation will lead to minor scars or burns in the nasal mucosa. So there is no bacteria to protect you from fungus, and there is injury to your nasal mucosa by repeated steam inhalation also. So what happens is that the fungus will find it easy to get into into your epithelium and through the base membrane into your endothelium as well. This alone will not ensure that you are not going to get the disease. You need to be an immunocompromised host also. Then, so this means that why we are having increased number of cases of COVID-associated mucormycosis in India cannot be explained by the increased prevalence of diabetes or by the prevalence of the use of steroids alone. It is truly multifactorial. Then we need to look at the use of mask. So in order to prevent this COVID-associated mucormycosis from occurring, the most important thing is going for universal masking. Universal masking means that you can protect yourself from inhaling the spores. Having said that, you need to follow the mask hygiene as well as the mask etiquette. You should not be reusing the N95 mask or the triple layer mask. The cloth mask you can reuse in the right way. That is, you can actually clean your mask and then iron, and then only you should use a cloth mask. Otherwise, what will happen is that a moist or a damp mask is actually the right environment for growth of this fungi, and inadvertently you will be inhaling the spores of this thing. Another practice that we have observed is not in Kerala but in our neighboring states is that when you are using steam inhalation, they are adding turmeric, the neem leaves, as well as the clove, etc. So these are organic material. As you rightly mentioned, all the organic materials will have these fungal spores. You just put turmeric outside in a wet environment and see there will be black dots. So these black dots are nothing but the fungal spores. So if you are inhaling these spores, it means that you are creating a channel for the spores to reach your nasal mucosa. So having said this, as John Panikkar sir said, the mucormycosis being treated properly itself. So if you give the best possible treatment, the outcome is 70% may survive. The mortality is still 30%. Usually the mortality associated with COVID-associated mucormycosis is around 40 to 80%. Another aspect is the drugs which are being used. That is usually the antifungals. The liposomal amphotericin, actually it is 50 milligram will cost 3,000 rupees, and the dose is 5 to 10 mg per kg. So it is not going to be 3,000 rupees. It is going to be around 30,000 rupees per day. And the duration of the induction phase is going to be 3 to 6 weeks. So for 3 to 6 weeks, the patient will have to spend around 30,000 rupees per day if you are using the safe amphotericin, that is a liposomal amphotericin. So we have the conventional or the amphotericin deoxycholate, which costs around 300 rupees per day, but it is a bit more nephrotoxic. So the duration of treatment, induction is going to be 3 to 6 weeks, followed by a maintenance treatment, which will last around, say, 3 to 6 months. On top of it, we need to go for aggressive debridement. We have to remove all the devitalized tissue. That's a black tissue has to be removed. Only then the drug will be able to reach the site of infection. And most important aspect will be taking care of your glycemic status. The blood sugar levels have to be controlled. It has to be optimal. Second aspect is that if your pH is acidic, so it has to be brought back to normalcy. And acidic pH means that there is increased risk of viral replication of this fungi. So having said this, we need to focus on preventing this disease from occurring. How can a patient with COVID-19, because being in India is a risk factor for getting COVID-19. So we should be focusing on how to prevent this disease from occurring. We know that 85% of the patients in India with COVID-associated mucormycosis had uncontrolled diabetes mellitus. So we never had this much number of cases of COVID-associated mucormycosis in the first wave, because in the first wave, the number of patients that we had across India was actually much less compared to the peak in the second wave. So when your hospitals are flooded with patients, so you can see what will happen to your glycemic status. You won't get insulin injections on time. And even at home, majority of the patients don't have access to glucometers. So the COVID-19 per se can lead to alteration of the blood sugar levels. Steroid on top can make it totally uncontrollable. So all the diabetic patients should ensure that their blood glucose level is within the maintainable, within the control range. That is, the fasting should be around 110 and the postprandial should not be more than 200. So this has to be ensured. That is the best way in which we can actually protect yourself from getting mucormycosis. So all the diabetic patients, if you are getting COVID-19, or the diabetic patients who are living in India, should ensure that their blood sugar levels are in control. The second aspect is that the steroid should be used only under the supervision of a doctor. That is, without a doctor's prescription, you should not be using steroids. The third aspect is that the diabetic patients and other immunocompromised patients, like say post-transplant, those on chemotherapy, dialysis, etc., they should not be visiting construction sites, etc. So if the construction sites means it will be full of fungal spores, and they should practice uniform masking, and the mask hygiene and mask etiquette they should be using properly. They should not be using any damp mask. The fourth aspect is that ideally, a diabetic patient with COVID-19 should never be in home care. They should get admitted so that their glycemic status can be optimized, especially if they are put on steroids. The fifth aspect is that unnecessary use of antibiotics. You should know that for a viral fever, the antibiotics are not going to work. Antibiotics have a role only if there is a bacterial superinfection, which won't occur from the day one. It can occur maybe after day 10, if there are evidence of, say, a recurrence of fever with, say, a yellow sputum, etc. So antibiotics are going to be more harmful. The sixth aspect is that the steam inhalation for symptom relief, it is good, but then an uncontrolled diabetic patient and immunocompromised patient should actually refrain from doing repeated steam inhalation, which can damage your nasal mucosa. And the next aspect is, it is not yet proven, the use of zinc across India. So zinc and vitamin C, which is widely prescribed in India, as multiple studies published in JAMA, etc., have shown that The vitamins cannot prevent you from getting COVID-19. Vitamins cannot prevent the progression of the disease. Vitamins actually, that does not bring down the severity of the COVID-19 also. So what will happen if zinc is being used? Majority of the fungi require zinc for their growth. So just like iron, even though it is not conclusively proved, the fungi has something known as the syncophore, which it uses to go in search of these zinc molecules. Okay, and we are actually providing zinc to it on a platter. We are using a drug with no benefit in COVID-19 and which might help in the growth of fungus, even though it is not conclusively proved. The one thing we need to keep in mind is that, as far as Kerala is concerned, 96% of the patients of COVID-19 are having mild symptoms only. They do not require any treatment at all. They do not require antibiotic. They do not require vitamins. They do not require steam inhalation, nothing. What they require is monitoring at home, monitoring for the red flag signs. Our ability as doctors is to identify the rest 4% who will require treatment from hospitals. The rest 96% is better to leave them without any treatment modality at all. And another aspect for the diabetic patients is the indirect sugar they consume. There are so many drugs which are available in the Indian market, like the preventive pills which are full of sugar, then the cough syrups they will be taking for cough which will be full of sugar, the immuno boosters like say Chyawanprash and the honey, etc. They also contain sugars. There is no harm in taking this, but you should ensure that your blood sugar levels are within the controlled limits. So rather than getting the disease and getting treatment, always our aim must be to prevent mucormycosis from occurring. Thank you very much.
Thank you very much, Dr. Aravind, for giving your views in details. And I'm sure today what you have said is very, very enlightening to all our viewers. I would just like to highlight few of the things which he has mentioned, which are very, very important as far as the public is concerned. One is he says about the steam inhalation, because it was in the social media, especially the WhatsApp University, which was saying every time that one should go for the steam inhalation at least 4 or 5 or 6 times a day to prevent the COVID. And many, even I will say, I will not name, but many of even the ministers have mentioned this thing officially. The politicians have mentioned, leaders, which is according to what Dr. Aravind says, that kills the resistance power in the nasal, and that's why the fungus can go and fungus can impact. Secondly, he says putting the turmeric or clove is again, we are inviting more fungus to us, because he says if you put the turmeric outside in the water and you will see the black spots. Yes, it is. I think everyone in the house has also experienced that is nothing but fungus according to him. Then he mentioned about the antibiotic like erythromycin, etc. People just have some fever or cold, etc. They used to go for the erythromycin. But what he says that is also very, very risky. Mask, because mask in India especially, people are not wearing the mask like surgical mask because N95 is basically for the medical people. But cloth masks, now they says that the cloth mask is not good because it's not going to prevent the if you are washing it, it has to be washed, but it has to be dry, because if it will be wet, then it will again be a field for the fungus virus. Then he has mentioned one more thing is about the cost of the drugs, which I was just calculating. Please correct me if I'm not wrong. It works out to be about 25 to 30 lakhs rupees per patient. Is it correct, doctor? You said 3,000 rupees per dose. And you said every day, how many doses to be given?
It will work out to be around, say, 15 lakh rupees, 15 to 20 lakhs.
So about 15 to 20 lakhs rupees, a very, very expensive thing. If, again, I am saying, if the patient gets the medicine on the rate, the retail price, which I'm sure everybody knows that it is not at all available on the retail price at all, which we are seeing in the media every day. That is one aspect. Then he says those who are having diabetes or those who are having any signs of the COVID, or those, they should try to avoid going to construction site. Or in my opinion, I think Dr. Aravind will correct me, anywhere where is a ponds or such type of thing where the infection chances are more. Is it correct, Dr. Aravind? One should avoid the water bodies so stable, not the running water body, those who are like ponds, etc.
The thing is that, no, since it is present everywhere, onus has to be on universal masking. Why we mention construction sites is that so much amount of the air, the fungal spores in the air will be more in the construction sites. In the
Okay.
pond and all, the amount of fungal spores in the air may not be high.
Okay. So basically the construction site. Then he has mentioned about the zinc and vitamin C. Last year, everywhere it was mentioned that the zinc is the best remedy for the COVID. But the research after the conducted was saying that zinc has no role. And according to him, zinc is again giving a field on the platter for the fungus. But I was talking to one of the ENT specialists. He says that the zinc, if the body is not absorbing, it passed away. So he was of the contrary view. He says that zinc has no role in this black fungus. But as Dr. Aravind has also said, there is no conclusive of studies in this still, is in the research thing. Then about the vitamin C, he says there is no role of vitamin C to stop the COVID-19. Two more things which I would like to highlight is the Chyawanprash and honey. As we know that people says to increase the immunity, please have the Chyawanprash, and they are giving the Chyawanprash to everyone, even a child or an elderly person. And the honey, they says that honey is the best. But what Dr. Aravind says that this contains sugar. One has to be very, very careful for this. Correct, Dr. Aravind, if
Actually, the thing is, Chyawanprash and honey are not bad things. Only thing is, no, people with diabetes mellitus, when they are consuming it, they should ensure that the blood sugar levels are in control. They may not be knowing that ideally honey should not be containing sugar, but majority of the honey available to us in India contains sugar also. So they can consume honey and this Chyawanprash, but the thing is, they should ensure that their blood sugar levels never cross 200. If they can't ensure that, better not take these things.
That is also a very contradictory thing. That Chyawanprash and honey is for, because honey, as we know, their media reports are that all the honey, maximum of honeys, branded honeys contain sugar, which is going to harm. So what Dr. Aravind has given the complete details, why this thing is happening, why not, what are the indications, how it can be treated, and what things we can avoid till the time the COVID is controlled, so this disease can be controlled. Thank you very much, Dr. Aravind. You have given quite a detailed thing. So I am sure that our viewers, because it's a new thing, nobody knows about this. And I will tell you very frankly, when I was doing the research to prepare this program today, it was very difficult to get the details because it's not available even on the Google easily. Thank you very much, Dr. Aravind, for enlightening us, all of us.